occupational therapist with the autism program in North Battleford, Saskatchewan.
And I'm Nikki Bretzer, autism support worker with the Don Ross Center in North Battleford, Saskatchewan. We work with the autism program with children ages 0 to 18 with a diagnosis or a query of autism.
Autism is a neurodevelopmental condition that impacts many areas of one's life. Symptoms include difficulty with communication, social relationships, and rigid and repetitive behaviors that impact their day-to-day lives. They have difficulty understanding people's thoughts and emotions, as well as trouble communicating their wants and their needs. Autism is diagnosed on a spectrum, meaning no one child is the same.
When children have difficulty communicating and understanding others, it can be very frustrating. Because of this, children with autism have the potential to act very violently towards themselves and others. In our workplace, we were experiencing violence frequently from a number of our clients. We would be kicked, punched, slapped, hit, spit on, and headbutted pretty regularly. Because of this frequency of our violence, we found ourselves burning out really quickly and dreading working with certain clients.
At a meeting with the Health and Safety Department to address our safety concerns, we were told about the importance of documentation and making sure there's a cut point in therapy. There were a number of solutions discussed in this meeting that we thought were not suitable for our program, such as stopping treatment with violent clients. Additionally, in this meeting, we were told that we should become WAVE trainers. We had taken WAVE previously, but we didn't feel that it met all of our needs.
But we continued with the process and followed up with the Health and Safety Department to figure out our next steps in finding the solution to our safety issues. We conducted safety assessments of the therapy spaces and continued to research education opportunities to improve our safety. We followed the recommendations of the meeting and we made sure we filled out all our incident reports every time something had occurred. In doing this, we realized that we were previously normalizing violence in our jobs and that our incidents were actually occurring more frequently than we previously thought.
While taking the WAVE Train the Trainer course, staff development was very empathetic and supportive of our situation. They encouraged us to fill out documentation and also assisted us with advocating for environmental changes and communicating strategies to improve our safety. It was here that we realized all of our incident reports that we had been filling out were being read, reported, and being investigated by the OH&S committee.
Shortly after attending the WAVE Train the Trainer, we were approved to take additional training designed specifically for people working with autism and other developmental disabilities. Staff development encouraged us to modify the WAVE training to include our new knowledge in order to make it specific for the autism program. This modified version became our new pediatric WAVE training. We met with staff development to review the content and were approved to roll it out to all pediatric departments.
This training has made a huge difference in the number of incidents we see in our program. It was a long road of frustration, but with the support of the Health and Safety Department, we were able to develop something that was more suited for our program while still keeping the core basics of WAVE.
When we began to take ownership of our safety, we started to understand it is okay to have a cut point and that more of the solutions from the Health and Safety Department fit than we originally accepted. We still hope to make a number of environmental changes that will support safety in our therapy spaces.
I have also recently joined the OH&S committee at the Don Ross Center in order to continually advocate for our program and safety needs. We also practice one of the new breakaway techniques at each of our VIS walls in order to strengthen and promote our safety culture and keep ourselves up to date with our training.
To provide services for our clients, we need to keep ourselves safe.
That is why it was important for us to not give up and find solutions to our safety concerns.